Hello and welcome to yet another episode of Hair Talks by Terra Medical. As you can see from our very expert lighting crew, we've got some blue light and some red light today, and the obvious topic we're going to be talking about is iron.
3, 2, 1.
Now, it's commonly been said that iron deficiency is one of the prime causes of hair loss in women. I don't necessarily agree with that. It is one of the causes that we investigate for, but it's definitely not the most common cause of hair loss in women. I would still say by far the most common cause of hair loss in women is androgenetic or pattern hair loss. So iron is a very important mineral to sustain life. And you can think of iron in two main segments: input and output. In women, your iron output occurs during the menses, or what some people call menstruation. You will lose blood from there, and consequently your iron stores will deplete. Other examples of when you use up iron would be in the state of pregnancy, the state of severe illness, when you're recovering from an injury, or things like building and putting on muscle. Your intake, on the other hand, will depend on what you consume. So in most cases, iron comes from red meat, from fish like salmon or tuna, or non-heme iron would be available in green leafy vegetables such as broccoli and to a lesser extent spinach. Now, it would be in your best interest to balance the input and output so that your overall iron storage levels can be consistent. We diagnose iron deficiency clinically by examining the patient, by checking their blood pressure, by looking for features of low iron in their conjunctiva, but it's more accurate to get a blood test done. Now, many markers in a blood test can indicate iron deficiency, including things like ferritin, mean cell hemoglobin concentration, the hemoglobin counts, iron saturation, total iron binding capacity, and the list goes on. But the main one we look at is the ferritin level. It is thought that ferritin is actually stored in the hair follicles, and when you're deficient in iron, some of the ferritin in the hair follicles is borrowed into the bloodstream. And overall, when you lose too much iron from other areas such as bleeding or recovery, as mentioned before, you have a depletion of that ferritin stores. To go back, ferritin is a molecule that's circulating in your bloodstream that actually binds and stores iron and will release elemental iron when your body calls upon it. For example, when your bone marrow calls upon these iron stores to produce red blood cells and hemoglobin. A relatively low normal ferritin level may not be sufficient to sustain good hair growth. So in a blood screening, when we see the ferritin levels hover around 20 or 30, of which the low normal range is 10, we sometimes still tell our patients that high iron intake will be beneficial for their hair. What we're aiming for is actually a ferritin level of something more than 60 to 80 to ensure that we know that we're not iron deplete and actually have enough iron stores to grow that new hair out. Iron deficiency should be temporary. If you think you have iron deficiency, you should get to a doctor's office, get yourself tested, and get the appropriate treatment initiated. Replacing iron tends not to be hard, but treating iron deficiency actually has to come at treating the underlying cause. For example, if menorrhagia or excessive menstrual bleeding is the main cause of iron deficiency, we will refer you to a gynecologist to have that checked. Is there a secondary reason for bleeding too much during your cycles or during your periods? Or is there some anatomical abnormality that we're not accounting for in the uterus which needs an ultrasound to identify? Sometimes, plain and simple, you're not taking enough iron. You could be somebody that rejects meat, following a vegetarian diet, not having enough heme iron from your steaks or your burgers. You could be somebody who is having a poor appetite or generally a small appetite and just don't have enough iron consumption on a daily basis. Now, that would have to be solved by telling you that your dietary intake is just insufficient. We might have to make some changes to your diet, and some people won't be able to take those dietary changes, and we have to resort to supplementation in a tablet or pill form. In severe cases of iron deficiency, iron infusion may be required, and that's actually setting up a drip and dripping in elemental iron into your body over a period of time. That's usually done more in a hospital setting because there could be a risk of allergic allergic reactions to that infusion. Now, if you're on iron supplements or you're aiming to consume more iron in your diet to increase your iron levels, here's a few tips for you. Firstly, don't take iron with dairy products. The calcium levels in the dairy are high enough to block the absorption of iron to a certain extent. So you would want to separate those two food groups out by a few hours. Secondly, take more vitamin C in your diet. So eating some fruits together with your iron-containing foods could help your body actually absorb more iron through your gut. If you suspect you're iron deficient, here are some of the symptoms that people who have mild iron deficiency may experience. Hair fall is certainly one of them. Giddiness or lightheadedness can be one of them. Exercise intolerance can be one of them. If you're severely iron deficient, you would end up with some form of iron deficiency anemia, and not enough oxygen is being carried to your brain or to other parts of your vital organs at any one time. And that could result in chest pain, shortness of breath, or even fainting spells, which can be quite life-threatening. Now, don't just go out and eat a bunch of iron. When it comes to iron, there's some genetics to consider. There are conditions such as thalassemia or such as hemochromatosis that could result in you over-consuming iron when your iron can't actually go up that high, or you could build up iron in your body and your liver and cause iron overload. Consult your doctor first. Let them know that you're suspecting that you have iron deficiency. Allow them to do a blood test for you. Find out what the levels of your ferritin is before you commence on some sort of iron supplementation regime or increase your iron intake in your diet. A lot of times, once we've corrected the iron deficiencies, once we've seen the ferritin levels climb back up, we do see hair regrowth. This hair regrowth could be quite slow, so we commonly tell our patients to use another stimulatory treatment such as low-level laser light or minoxidil to encourage those hair follicles to grow a bit quicker so you can see faster results. In summary, remember that iron is a match of input and output, and if you're a lady, you're more prone to iron deficiency because of that monthly output. So make sure your diet is consistent in iron consumption, or that you're actually consuming some kind of iron supplementation if you're somebody who has heavy periods, for example. Thank you for listening to this episode of Hair Talks. I hope this has been very informative for you. If you're a lady and you think you have iron deficiency, do leave your comments in the comment section below. Let us know your experience with iron deficiency and hair fall, and don't forget to click like and subscribe.